Haemophilia disease. This is considered as a sex-linked recessive disease, which shows its transmission from unaffected carrier female to some of the male progeny, which has been widely studied also. Here we see that in this disease, a single protein that is a part of the cascade of the proteins involved in the clotting of the blood is affected also. Due to this, in an affected individual, a simple cut will result in a non-stop bleeding, that is also called as a bleeder's disease. The heterozygous female carrier for the hemophilia may transmit the disease to the sons. The possibility of a female becoming a hemophilic is extremely rare because mother of a such female has to be at least a carrier and the father should be the hemophilic, unviable in the later stages of the life, that is incapable of growth and development also. What is cascade mechanism? If you see, cascade clotting mechanism is constrictions of these blood vessels, formation of a temporary platelet plug, activation of the coagulation of the cascade, formation of the fibrin plug or the final cut also. So it is been followed by the factor first to 12th, which activates the factor 11th, and then factor 9th, plasma thromboplastin component being released, then factor 7th, which is also extrinsic pathway, and factor 8th is been activated because of 9th and 7th anti-hemophilic globulin factor been released, then factor 10th, then factor 5th, factor 2, factor 1. So this is how the clotting of the blood will be taking place. So due to this, the persons are not able to produce the proper amount of the clotting factors. So hemophilia was first discovered in the Queen Victoria family. This is also called as a royal's disease because it is very common in the royal families of the Europe. The family of the pedigree of Queen Victoria shows a number of hemophilic descendants as she was a carrier of the disease. Carrier female appear normal, but hemophilic males suffer with severe loss of the blood through wounds and also sometimes die because of this. And here three types of the hemophilia will be seen: hemophilia A, hemophilia B, and also hemophilia C. Hemophilia A is a severe form which is caused due to the eighth factor. In this patient's blood fails to coagulate due to the deficiency of blood clotting factor 8th anti-hemophilic globulin. This is more common, 80% of the males. And hemophilia B, mild form, which is due to the ninth factor. In this patient's blood fails to coagulate due to the deficiency of blood clotting factor 9th, plasma thromboplastin component, or Christmas factor. This is also called as a Christmas disease, less common in this 20% of this because it is been identified first detected in the Stephen Christmas. So we call it as a Christmas disease. Hemophilic. See, this is a very rare and it is an autosomal recessive gene which are present on the chromosome 4 is responsible for that. So here, if a carrier female marries to an affected male, then the children will be affected female, carrier female, and affected male, and also normal man. These are the possibilities of the pedigree representation. Thank you for watching. Please do subscribe my channel and share it. Thank you.